I'm going to share a bit. You didn't cough, John. I'm going to share a bit about the Community Wellbeing Index and the Valley demographics as a backdrop to this panel discussion. As you know, we do live in a new digital age. Data and information is now very easy to obtain, literally at our fingertips. We now are able to use data, analyze it, take more data, look at the facts, look at the figures, and then we can look at the data again and make changes. That is what we want to be able to do, is make a difference by using and analyzing the data. There's hard data. Data I call hard data, data that comes from the census, from test scores, assessments, etc. But there's also soft data that comes from surveys, data that's based on a person's own experiences, their perceptions of things. This index contains both of these types of data. As I mentioned, that we have participated in the Connecticut Community Wellbeing Survey that was conducted last summer by Data Haven and Siena College. And some of the results that we take a look at that data. What really is the goal in analyzing the data? Well, to get better scores, to show improvement, but really bottom line, it's about improving the quality of lives. Well-being surveys ask, as I said, those soft questions, like how happy were you yesterday? How would you rate your overall health? Do you have relatives or friends that you can count on if you need them? There are three major factors, as you can see on the screen, that we would say contribute to a person's well-being or quality of life. Their community life, health and employment, and having their basic needs met, all come together to give them an overall well-being score. Those questions that I asked earlier, those are some of the questions that put together a community index number, a community well-being score for the Valley. And I have to say that the United Nations has actually said and identified that measuring local well-being should be a global priority. Those questions that I asked, those aren't questions that you're going to find in a textbook. They're not questions that you're going to find easily. They have to be asked, and it's a person's own personal perception. So let's take a look at what we see when we look at the Valley. When we look at the Personal Wellbeing Index score for the Valley as a whole, it is very similar to the state. When we dig a little deeper into the scores by our Valley by income, all of a sudden you start seeing we're moving down in this category of those that have very strong needs financially. When you dig deeper and look at it by experience, meaning lack of health care, food insecurity, housing insecurity, all of a sudden their well-being scores in this population are extremely low in comparison to the state. One of the things that we found when we were conducting all this information is that this is a point that we want to take a look at in the Valley, because it's true anywhere in our nation, but we're talking about here in the Valley. And we're talking about the differences here in the Valley, and there is a group that have strong disparity. So now about the changing demographics. I'm going to share some of the higher demographic data with you. So we can get on to the panelists. I'm going to refrain from doing my commenting too much and leaving it to them. There are numbers, lots of numbers. So what I'm going to say is just let it soak in. Don't take notes, it's in the data, or in the book. So the Valley population has increased by 12% from 1990 to 2014. Bringing our population up to 139,674 to be exact in 2014. The population of children 0 through 17 years old hardly increased. And the young adults 18 to 34 decreased. I'm going to ask you what you might think of that. And then the population of 35 to 64-year-olds grew the most during this same period of time. The Valley has an increasingly diverse population. 1 of 3 children identified as a member of a racial or ethnic minority in 2014, compared to just 1 in 10 in 1990. We see this as evidence in our schools. The elementary schools are much more diverse than our high schools. We have an aging population. By 2025, 1 in 4 Valley residents will be seniors over the age of 65. I'll be one of them. Growing population of seniors, and 90% of them really want to age in place. This is why we asked Sue Riley to join us on the panelists today. Residential mobility, otherwise known as transient population, plays a critical role in our schools and academic achievement. Derby has one of the highest residential mobility rates at 14%, meaning 14% of Derby residents moved last year, or in the year 2014. That's an incredible number. I can't tell you where they moved. They could have moved within Derby, but they moved, and you can imagine what that does to the kids and the families. An average of 20% of Valley residents are low income. However, 38% of Ansonia and 26% of Derby residents are classified as low income. Low income is defined as living in households with annual incomes less than 2 times that of the poverty rate. So that's $32,000 for a family of 2 and $48,000 for a family of 4. 39% of Valley residents were cost burdened. Cost burden is when the housing, which means spending more than 30% of your housing, is cost burdened. And 17% of those were actually severely cost burdened, meaning that they spend over 50% of their income for housing. I'm going to have David address the point of, okay, let's add childcare onto that, and let's add food onto that, and where do our families end up? So these demographics give you a good synopsis of some of the high-level data points that are influencing the quality of life for some in the Valley.